Well, look, as far as this virus is concerned, one of the things we've learned is it's far better to go early than to go too late. So whatever I may think about the government's tiering system, it's really important from midnight tonight, we will follow the rules. We're going to be in tier 3. We've got to abide by the rules. That being said, I think the government needs to realise the consequences of them putting London in tier 3 as far as our economy is concerned. There are many pubs, bars, restaurants and cultural venues that have spent a lot of time, effort, energy and money making their places COVID secure. And when they close tonight, many of them may not reopen, which leads to billions of pounds of money being lost from our economy and potentially hundreds of thousands of jobs being lost. And my concern is that the government appears to be retrofitting an ineffective tiering system around an issue of the virus spreading. And I'm not sure if it will make much difference to the virus spreading. And that's why I've been calling on the government to do much more in that age group where we know there's been the biggest increase in the virus, a 75% increase in the last, we've got numbers, those aged between 10 and 19. Many of them don't go to pubs, bars and restaurants. I've not seen a child of 10, 11, 12, 13 in a pub, bar or restaurant. And so my concern is that the blunt instrument of tier 3 won't do what's needed, which is to reduce the virus quickly.
Can we therefore ask you to be explicit? I mean, do you or do you not agree with the government decision to put London into tier 3? I mean, we've said it a few times in the programme this morning. It seems somewhat counterintuitive to move 10, 11 million people into the top tier, 7 or 8 days before, they're all heading home for Christmas.
I think the government's policy of going from London in tier 2, then tier 3, then tier 0 for 5 days, then tier 3, and potentially in January a national lockdown doesn't make sense. And so I've been lobbying the government with council leaders in London on a cross-party basis for them to various things to ensure we get a grip on the virus in London. For example, making sure we have mass testing available in schools for those children who may have the virus and not realise it. For example, at those schools that aren't COVID safe, haven't got the mass testing, maybe closing a few days earlier because those very same children who could have the virus and be asymptomatic will be hugging grandma and grandpa next week and potentially passing the virus on. Another thing we're lobbying the government for is to give financial support to those businesses being required to close tonight, because unless they give additional support, these businesses will go bust.
How understandable is the government's decision to move London to tier 3 when it does appear that the greatest strain being placed on the NHS isn't happening in central London, isn't happening just south of the river from where we are. It's happening in Essex, it's happening in Hertfordshire, it's happening in Kent.
The problem, this virus doesn't respect boundaries, whether it's borough boundaries or whether it's county boundaries. We do know a couple of weeks ago, we were seeing particular problems in the northeast of London and the boundaries of Kent and Essex. But the virus spread so quickly. It's like, imagine a swimming pool and there are lanes in a swimming pool. You throw dye in the swimming pool, that dye won't respect one lane in the swimming pool. And so that's why it's important to have a one London approach, which I fully support. We've got one NHS service in London, one police service enforcing these rules, one transport system. But you're right, it's the neighbouring counties as well, which have an impact on our city. That's why, look, whatever we think about the government's decision, we've got to follow the rules tonight to make sure we can reduce the chances of the virus spreading. But it is nonsensical to go from tier 3 to tier 0 and then back to tier 3 when we know in January, according to previous years, the NHS has the busiest month. And this January, my fear is the NHS could be overwhelmed. And the real kick in the teeth for some people will be the fact that we know the vaccines are now being rolled out. Many of our older friends are receiving the vaccine. Imagine how heartbreaking it will be if these older people who could receive the vaccine and live long, fruitful lives don't receive the second dose, catch the virus over Christmas, and God forbid lose their lives in January, February.
Mr. Khan, I'm going to hand you a metaphorical Grinch outfit right now. I mean, from what you're saying, isn't it possibly the best idea that we cancel Christmas, that we close that window?
You're not being Grinch at all. I think what you're doing is following the science. And actually what we've seen across the Europe and across the world is those countries that are more effective at dealing with this virus having short-term, more restrictive measures that helps health and wealth. So look at Germany and Netherlands. They're not, for example, relaxing the rules over Christmas for 5 days, allowing 3 households to mix of unlimited numbers. which could lead to the virus spreading.
Okay, Mr. Khan, I'm sorry to interrupt, but can we just be explicit? Are you saying that we should not have the Christmas window, that the Christmas window should be closed?
I heard the government say yesterday they haven't ruled out further changes. I would encourage the government to look at their rules over Christmas. We have to have a four-nation approach. You can't have one rule for London, one rule for the rest of the four nations, because people are family across the nations. And what I'd say to the government is, I'm not sure you got it right. In fact, I'm sure you haven't got it right in relation to the relaxations over Christmas. If they don't change the rules, my message to your viewers is we're under no obligation to do all that's allowed. There's no reason why you have to kiss or hug an older relation. If you are seeing members of other families in your home who are older, even if they're younger, open your windows, allow ventilation, because none of us wants to inadvertently pass the virus on.
I wonder if we might just briefly dwell on the clash that it appears is forthcoming between the Education Secretary, yourself, and indeed Greenwich Council. It is the Labour Party's position, as well as the government's, that the schools should remain open as far as is humanly possible, given the negative impact that we saw on young people in the first lockdown. Why do you feel that closing the schools, even if only for a short period of time, is a good idea?
I want schools to be open. We've seen the consequences of schools closing from March until September. Every day a school closes is bad for our children. There have been heroic efforts from our teaching staff, but here's the problem. We know that the age group for which there's been the biggest increase in the virus spreading is those aged between 10 and 19. The last week for which we have numbers showed a 75% increase in the virus amongst this group. These children go home, give the virus to mum or dad, and these children will break up on Friday and potentially be hugging grandma and grandpa next week, potentially passing the virus on. So what I'm saying to the government is they need to make sure that our schools and colleges have mass testing to test their children and staff. And the good news is some schools and colleges have this. I visited one in Waltham Forest yesterday who have mass testing, so that's a COVID-safe school. My concern is there are some schools, many schools, that aren't COVID safe. If it's the case, these schools can't be made COVID safe over the next couple of days. Those schools should 1 or 2 days or 3 days before the normal breakup close early, have more online lessons this week, and maybe open 1 or 2 days later in January to enable mass testing to take place, because my concern is these children aren't showing any symptoms, they're passing the virus on, and we won't get a grip on this virus, which will be catastrophic for those who catch the virus, who are older or have underlying health conditions, and also potentially the NHS, which could be overwhelmed in January.